I grew up in Wyoming, a small town called Riverton, Wyoming. It's in the middle of the state. My mom was a dental assistant most of the time I was growing up.
I decided back when I was in high school that I wanted to do something in healthcare. But at the end, I did settle on dentistry.
When I was in dental school, I thought I would be a general dentist until I had an instructor who was a prosthodontist. And he really opened my eyes to an aspect of dentistry where it involves fixing everything that could possibly go wrong in the mouth. I knew that's what I wanted to do.
The thing that really grabbed my attention with prosthodontics was that it is complex treatment. You get to learn all these different tools and build this nice tool belt of ways that you can take a very complex problem, break it into pieces, and use this tool for that and this tool for that. And that's how my brain works.
So Dr. Farley and myself were classmates in our residency. So after dental school, we met. We did a 3-year residency to become a specialist called a prosthodontist.
You know, when there's only two of you for 3 years, side by side, through every class, through clinic, through all the late nights doing lab work, two things can happen. You're either gonna get along or you're gonna hate each other. And we got along, we really did. We spent more time with each other during 3 years than we did with our families.
And then we graduated, I moved to Phoenix and he moved to Wisconsin and practiced for 8 or 9 years, separately there. And he got really sick and tired of the weather in Wisconsin. And I kept telling him how great it was here in Phoenix and how our practice was growing.
It just clicked that, hey, I can get away from bad weather, go to sunny Arizona. We already knew that we get along and we work well together. And so it just made perfect sense. I said, can I apply for your job? And I think we were talking like in January, and a few months later I was already out.
It just kind of morphed into that. He was working in a hospital, so he was able to kind of cut ties there and moved here, and we decided to build Revive Dental Implant Center together. It's kind of been our vision from the beginning. Having a business partner that you know so well and have the same values, the same, pretty much everything we think very, very similar, is a huge factor in that. We complement each other very, very well. He brings a very calming feel to our patients and to our practice. And so one of the things that was very important to us was this being like a family atmosphere.
We do have a fantastic team. We have people who have been in dentistry not long up to many, many years, everything in between, but everybody on our team loves people. They love helping. They are here for the right reasons. They enjoy their job. They're good at what they do, their piece in this big puzzle that we're putting together. And patients know it. They see it, and we've heard it time and time again.
Dr. Farley and myself are also co-owners in our laboratory called Renew Digital Design. And it just so happens we're in the same building, but not only does it focus on Revive patients, but we have clients all over the country.
A few years into practice, I found that digital was making it into dental offices. People were getting 3D printers and materials that could be used in the mouth, and finding software or building software that could be used to design teeth. When I found that this was happening, I kind of jumped in with both feet, where we can sit down at a computer and design something to look beautiful, but yet precise on the computer, and then take that and make something from it. Whether it's 3D printing or milling, to make something, and then once it's there in your hands, to then try and use that, the art background that I have, to try to then make it look fantastic, make it look realistic.
Not all lab work is created equal. Not all teeth are made out of the same thing. You wouldn't believe how many people I visit with that don't know they have plastic teeth, that they paid $50,000 for plastic teeth. And so there's lots of different options in what we can make these teeth out of. And so having our own laboratory allows us to use the best materials, be able to make it in the most efficient manner, and be able to make it the most beautiful.
When we were in school and we learned how to do this complex treatment, we learned to do it the same way it's been done for many decades prior to now. But then came digital dentistry, where we can design things on the computer, we can 3D print, we can mill, and the game just changed. And so we can take the same knowledge that we had before and apply it to the technology we have now at our fingertips, we can make a set of teeth that you can test. You can take it home. You can wear it home and see what you think, and then come back and say, I love it. Let's go to the final teeth now. That wasn't possible back when I was in school. And so you get better care, more predictable care, more beautiful care, and so that is also a reason to consider Revive Dental Implant Center over another facility.
And so that's how we created the Dental Implant Center, and we can really focus in on changing people's lives with the all-in-4 treatment.